Okay, so let's kick things off with Ed. This is Ed Pietroskie. He's the Director of Technical Services here at NTEC. He's got over 40 years of experience in the industry. Phenomenal speaker. He's always touring the state and the country, sharing his expertise. So Ed, take it away.
All right, well, very good. Thanks everybody for joining. I can see some of you is on my sidebar, but not everybody. And of course, let me say my spiel, and I'll finish up at the end talking about and take some questions if you have any. But I'm going to talk a little bit about have wastewater operations and treatment changed during COVID-19, and away we go. Just a quick introduction. You gave me a soapbox. I'm going to take it. Yeah, has operations changed is going to be one segment. Should operations change is going to be another segment. And the last segment is if there's one constant in our company. So I got 20 minutes to stand on this soapbox. I'm going to take every minute of it, probably a couple extra. The wastewater industry, in my humble opinion, exists for the purpose of protecting public health and safety. We remove pathogens from wastewater and biosolids before we let them re-enter the environment. All of this is mandated. US EPA, DEP, other organizations have made laws to protect the public health and the environment, public health and safety. Government has the right to determine when mandates are required for the public good. You may not like getting a sewer bill, but you do not have a constitutional right to poop in your neighbor's yard. So what's the problem with face masks? Surgeons have worn masks for over 100 years to protect the patient who is open, literally, to infection. Now, it also happens to be a cheap and easy method to protect public health and safety from COVID-19 until we get a vaccine available. Government has the right to determine when mandates are required for the public good. You may not like wearing a mask, but you do not have a constitutional right to poop in your neighbor's face. It's not political. It's good, sound science. Of course, I'm an engineer, so that's science. And, you know, political leaders and scientists can discuss this intelligently. And like all good mandates, they have guidelines, and they issue them as a mandate, and we follow them. Political leaders can mandate to protect public health and safety. I'm almost off my soapbox. Social distancing, another easy method to protect public health and safety until a vaccine is available. Notice I didn't say cheap. The cost is a loss of business, loss of jobs in some cases. But, you know, people have adapted. You know, the most obvious things we see are everybody with curbside pickup, order online, get it delivered to your house. I had groceries delivered to my house. I haven't been in a grocery store since this whole thing started. Some didn't adapt. There's been shutdowns of businesses. Some had to shut down because of mandates. There's been layoffs. Some people have gone bankrupt. It's unfortunate, but it happened. Some businesses have actually grown. Amazon has grown. Ups has grown. Zoom, their stock is like gone through the roof. So many people are using Zoom now and buying memberships. NTEC has actually grown a little bit. In spite of all of us at NTEC working from home, we've actually hired a few people because the demand for our services is as good as it's ever been and actually a little better. So again, government can determine mandates for public good, and so can an employer about their employees. Our employer said we're going to work from home, we're going to continue to work from home until we get through this. Wastewater industry cannot shut down. It is essential. And not because the governor said it's essential and you guys can go to work. It's essential. Those people don't stop using their toilets. The sewer system never sleeps. We have wastewater coming all the time. We have to be smart enough in the wastewater industry to not shut ourselves down. We have to improvise. We have to overcome obstacles. We have to adapt the way we do business because we have to do our business. We have to keep it going. Now, has operations changed? Not really. The plants are pretty much what the plants were. You got to go in there, the operators, they got to monitor the process, make adjustments, operate equipment, turn it on, turn it off, what have you. They got to do lab tests to know the plant's working right. They still got to maintain equipment, so it doesn't fall apart. They still have to order supplies and parts and what have you. That hasn't changed. Managers still have staff meetings. They review records. They approve various actions, make their reports to DEP. All of that continues to go on much as it has been. And then the administrative staff, payroll, accounts payable, it's computerized systems, but they're going in and they're operating these systems. Customer billing and payments, again, maybe computerized systems, maybe payment handling is handled by an outside third-party bank or something like that, but you still have to be processing things. Collection system workers, they still got to go out and inspect the pump stations, maintain them. And customer service at locations is an extremely difficult one. Sometimes we have to go to a customer's house or place of business. And that's something that is maybe one of the most difficult because you're going into places you don't know with people you don't know. But systems are making changes to cope with COVID-19. I'm not going to go into those. A lot of us know what they are. So should operations change? I think yes, absolutely, we must. We must change to deal with this. And there's ways to do it. Some we know. Wastewater workers, though, are hard to replace and retrain. We have to be smart enough not to shut ourselves down. Our workers get sick. They're not easy to replace. They have equipment knowledge, historical trends. They have laboratory knowledge, environmental regulation, confined space entry procedures, manhole sewer line locations. Enough, I could fill pages with this. The administrative staff has work to do. Payroll, you want a paycheck? Payroll's got to get in there and work. Customer billing, where do you think payroll gets the money from? Accounts payable, we need supplies and equipment. If we don't pay our suppliers, eventually they will stop sending supplies and equipment. So again, we can't shut ourselves down. We have to work. If you get COVID-19 in your office, in your treatment plant, in your facility, in all likelihood it's going to spread because we tend to work close together in the wastewater industry. Unless you stop the spread by doing things like wearing masks, management can mandate that in the office space. Wash your hands, duh. I have to say that to wastewater workers. Temperature checks. I've been to my doctor 3 times since this started. I can't get through the locked door until they come out and take my temperature. Maybe we should do that with our employees just to make sure. Daily symptom checks. The employees, make a checklist. How do you feel today? It's better to work from home than go to work and infect someone. Social distance, 6 feet at work. Maybe we can make more, a little more space than 6 feet. We work from home. NTEC's been doing it successfully, and I know others that have been doing it successfully. I know treatment plants that have been having some of their staff work from home or just work for the amount of time you need in the plant. Again, I could go into this, it's a slide by itself. But, social distance, keep staff meetings small, separate staff, close the office to plant visitors, only appointments. And again, work from home. And some examples, operators. Do you have SCADA? I've had plants that I've designed SCADA systems for. You could sit watching your TV in your living room and operate the plant, monitor the process, make adjustments. Lab tests might be a little harder. Some maintenance might be harder. Supplies to order them online from home. Maybe plan your maintenance out for the next days and what you're going to do from home. Again, keep those distances, mostly to not infect one another. Even the managers have a staff meeting, do it on Zoom. Review your records, approve various actions. Your DMR can be done from anywhere online. So again, these actions are available. Administrative staff, Computerized systems should be able to be accessed from anywhere. NTech has a very robust system. I could sit at my dining room table and I can access every client's file. It's a secure system, it's a VPN, it's got passwords. That can be done for any system. Collection system, again, gets a little harder to get out there and inspect some of that equipment. But again, SCADA can be a part of the solution. Customer service at locations is always going to be tough. Can you phone first? Can you solve the problem over the phone? Inform them that we're not going to enter your home unless people in the home have masks on. We're going to make sure it's safe before we go in. And maybe you have to have an extra level of personal protection equipment before you go in. I know everybody's going to say, Ed, it's almost over. Horse hockey. The plus size lady didn't sing yet. Oops, I'm sorry. I was supposed to say person. A little graph I picked up, and if you look on the bottom, this is from the Center for Disease Control, World Health Organization, where COVID-19 falls. And we don't know exactly where it falls yet. That's kind of a block because we're still collecting data. Percent who die versus how contagious. It's very similar to that 1918 flu epidemic. But here's the thing to look at this. There's other things on here. Swine flu, which was not that long ago. SARS was not that long ago. MERS, Ebola, bird flu. Some of them are more deadly. Fortunately, they're not real contagious, even though they're deadly, because you tend to get them and notice it, and then we isolate the people quick. With COVID-19, you could be running around for 2 weeks infecting people and you don't know it. You could have it and not have a symptom, not know it and be infecting people. That's what makes this tough. That's why all this protection, face masks, social distancing is so critical. Pre-existing conditions for anyone. These are some of the conditions that are just a sample of what can be a pre-existing that can make you more susceptible or increase your percent of dying should you get this COVID-19. We don't like to talk about what our conditions are, but I've looked at the complete list. I just show a sample here. I have 3 pre-existing conditions, me personally, and I think I look like a relatively healthy individual. So again, this can be critical to the whole thing. Multiple conditions increase risk of death. Again, this is something from Center for Disease Control. I didn't make this up. If you've got one pre-existing condition, you got a 25% chance of dying from this. If you have 2, that is another 26% more. And if you have 3 conditions, it goes up by 48, meaning it's almost 100% chance that you're going to die from this. So again, look at our workers. I read a study once. About 3 years ago, I read it, and the study was about 2 years old at the time, saying the average worker, sewer worker, was 59 and a half years old. Well, that guy is 65 now, and that's a pre-existing condition pretty much if you're over 65. So again, let's be aware of this. Be aware of this with our staff. We have to really take care of our staffs. They're hard to replace. Average disease deaths per day worldwide. And I thought this was so interesting when I saw it. As much as you can't turn on the news without hearing about COVID-19, but yet tuberculosis is the #1 killer. Now, maybe not in the United States or a lot of well-developed countries, but it's the #1 killer per day. And oh, by the way, #3, right below COVID-19, is hepatitis B. And there's something sewer workers should be worried about. Pneumonia not too far behind. HIV. I was around an executive director of a sewer system when HIV came into view. And everybody was looking about it and talking about it. My workers came to me and said, what are we going to do? I was embarrassed that I didn't think of being concerned first. Who did I call? I called the Center for Disease Control in Atlanta, Georgia. And they gave me advice. Interestingly enough, very similar to what we're hearing now. Sewer workers should practice good hygiene. Don't be dipping your hands in the sewage. And if you do have it, wash your hands. And we all do that. But again, those recommendations and that organization was someone I went to in the 80s for how and I had to deal with HIV in sewer systems. So again, gives you an idea. But here's the other thing that I think is important with this chart. The number of things you see on here. Swine flu in 2009, that was only 10 years ago. Going down there, you got Ebola, SARS. There's other things on this list. Don't think even after we get through COVID-19 that in another 5 or 10 years, we're not going to have something coming down the road that we're going to be faced with again. I think it's going to happen. It's going to happen more frequently. We need to be prepared. We need to start changing to adapt now, and those changes should be permanent. Which brings me to my last slide. And I learned this from a company I was doing business with once when I couldn't understand why they were changing the whole project. It's changing it from a location in Pennsylvania to a location in New Jersey. And the guy said to me, he said, our company president just had a meeting with everyone announcing all these changes, shift in locations. And he said, if there's one constant in our company, it's change. We have to learn to change and deal with this because we can't let our industry shut down. And that's the end of my message. Thanks for listening. Any questions?
Okay, actually, before we start on the questions, I will share the secret password, which is cotton candy. That's cotton candy. And that's if you're getting operator credits. There's a special form for you to fill out and then email back to the organizers for the conference. So you guys, we've got a small group here, so I welcome any of you. If you want to pose a question to Ed, raise your hand. I'll call on you, and you can hit your space ball or unmute yourself and join. Sorry, whoops. Jay Weissman, you have a question?
Yes. Hey, it's John Wiseman. Thanks, Ed. This was a great presentation. I really enjoyed it. One quick question, I know because it's so debatable, and I know it's a conversation with everybody. I know on that one slide, and I was really happy that you put that, to see the difference in the numbers in deaths per day and the different diseases and infections, viruses. I think at the top of that, was that updated on July 7th? Is that the very last update that they had? Because I know that, I mean, obviously.
No, I don't have the very last update because needless to say, this was a work in progress. I've been working on this for 3 months and 95% of it got done, I think on Monday. No, actually it was last week, I think on Thursday. So again, as I went to the internet looking for data, at some point you got to stop going back and looking for more data. So yeah, I'm sure it's changed since then. But the key is, as high up as it is, there's something that we all have heard about, tuberculosis, that's actually higher. So it's interesting.
No, that was really good. Like I said, I'm happy you included that in your presentation because it's sort of an eye opener as a visual to see the numbers. We think I was going into it thinking that COVID was going to be way high above everything else, but like you had mentioned, it's there's some close calls there with some of the other contenders. So thank you and great job again.
Yeah, and I'm going to share one other thing, and I hate the statistics, and I hate to sound like morbid or that I don't care about this, but someone said we're looking at this and seeing all these deaths, and unfortunately, it's a lot of people that are over 65. But they said, there's a lot of people die for a lot of reasons in this country every day. Traffic accidents, cancer, I think, might be way up there, lung diseases, heart attacks. And they said, a lot of those conditions make you more susceptible to dying if you get COVID. And they said, at the end of the year, we're going to look back and say, not that many more people died in the United States than normally die in a year. And you're going to also see, maybe in the fall, not as many people dying from heart attacks because they went early because of COVID. So that's a terrible thing to think of, but that is part of the reality. That when we were totally shut down and nobody was driving around, traffic deaths went way down.
Right.
So it is terrible.
It seems like it's one of those things where we won't really understand it all till 3 years from now. mean, you need time and then
Yes.
look at the data over not just a day, not just a month. But the interesting thing about the tuberculosis, I'm reading right now a book about the history of Milton, Pennsylvania, town in central Pennsylvania, tiny town. My one side of my family grew up there, and I'm writing a book on family history. And they're talking about people who have tuberculosis and they're sent away to a tuberculosis sanitarium or something like that. Like, wow, that must be a really, really bad disease. And then when I see it at the top of your chart, I'm like, shit, this is almost 100 years later and it's still that bad.
Yeah.
I had no
Well, again,
idea.
fortunately, not that bad in the United States, but still, there's places where it's that bad. And when it was bad in the United States, I consider it my second hometown, Whitehaven, Pennsylvania. Whitehaven, because it's way up in the Pocono Mountains, was known for having several of those sanitariums. Right?
Wow, yeah, I had no idea.
Yep, absolutely.
Any other questions for Ed? Because I have a few others. Anyone, any other questions for him? Okay, I'm not seeing any hands, so I'll pose one. Ed, you had mentioned that you were around when the HIV/AIDS thing struck.
Yes.
And as a person in charge of a plant, you're trying to figure out what do we need to do. You said it's very similar to what we're doing right now to take care of the COVID-19. Did you see other plants like going above and beyond and then realizing later, oh God, we really didn't have to do all that?
Well, I think everybody wants to go above and beyond, okay? But the message that I'm trying to say here is, if you're doing something to protect yourself from COVID-19, which is essentially a virus, don't think for 1 minute there's not going to be another pandemic. Bill Gates, who's not just a computer guru, was screaming about this possible pandemic in 2015. Obama, and I'm not getting politics here, whether, you know, he was good, bad, indifferent president, but Obama put together a task force to be ready for the next pandemic. And he's been out of office for 4 years. So people in positions to see this kind of data, you know, to talk to Tony Fauci when nobody knew who the hell Tony Fauci was, people were saying, hey, wait a minute, we might be on the verge of another pandemic. Well, sure as shit, here it is. And realize, and I'm no expert, I am no epidemiologist, okay? I'm a shit guy, okay? I get shit out of water for a living, all right? To put it bluntly. The path they believed that this was a bat cave somewhere in China, and the bat probably bit a hog in what we would call free-range hog farming, but over in China, they're running all, you know, bit a hog, and this virus adapted to living in a hog, because ultimately, viruses want to be in warm-blooded mammals. And certain kind go into certain kinds of mammals. And this coronavirus 19 made the leap from bat to hog to human. You think that's never going to happen again? H1N1. Yeah, same thing. So again, my point is, change the way you do business. Be ready for the next one. Maybe it's 10 years, maybe it's 5 years, maybe it's 20. I don't know, but I think we're going to have something again. That's my point.
Another question, actually, I want to pose to the group, because every time, well, if we were doing conferences, I'd be hearing stuff at them. So everyone who's out there right now, I'm curious, have any of you guys heard of any wastewater water systems with employees who have gotten the virus? Raise your hand if anyone has heard of anybody or known anything. Okay, so I saw one hand go up, and then other people are, or two hands go up. Okay, so it looks like there are a few cases that are out there. I'm just hoping that they're with younger people and not affecting the workforce too badly. Okay.